A lateral shift while squatting can be caused by a multitude of things at the ankle, hips, knees and lower back. We are going to have a look at how tibia rotation can be an issue. When squatting, two things happen to your tibia or shin bone: an internal rotation as well as a lateral glide to keep you stable when descending into the squat position. Testing for tibia rotation is pretty straightforward. All you have to do is sit down on a box or something similar while being shoeless. Rotate your lower leg and foot inwards while holding on to your knee to minimize the hip rotation. A quick side-by-side comparison shows an improvement after only a few minutes of mobilization. This tells us that we are working on the right mechanics and that we can improve further over time. Place a rubber band at the base of your big toe and apply pressure to the band. The reason being a focus on keeping even pressure at the whole foot while imitating the squat. If you start supinating at the ankle to accommodate the knee movement, the band slips out from under your toe when the compensation pattern starts. In the first exercise, you have to shift your weight forward while working into the resistance you're going to feel at your mobility end range. The cue here is to keep the foot stable while doing so, and keep the position for a few seconds before you shift your weight back and reset the movement. Keep doing this exercise for a minute or two and then move on to the next. The second exercise focuses on the lateral translation that happens at the ankle joint when squatting. Just like the previous exercise, you have to keep tension on the band under your foot at all times. Next step is to engage your glutes and shift your leg laterally. Keep the position for a few seconds before returning back to the start. Do this exercise for a couple of minutes and then you can go back and do the retest like we did earlier in the video. Since we already accomplished an improvement seen earlier in the video, the only thing left to do is to start squatting.